Hello, everyone. Thank you so much for taking time out of your day to join us for the Needy Med special topic webinar presented by our partner, the PAN Foundation, connecting underinsured patients with the treatments they need. My name is Carla. I'm the director of education initiatives at Needy Meds. And before we get started, I'm going to offer a few tips so you can make the most out of the presentation. And hopefully, my slide deck is in slideshow mode, so our guests, Amanda and Jessica, let me know if it isn't. So, some tips to offer. Of course, we encourage you to ask questions at any time by typing them into the questions. It's actually the Q&A or chat section of your Zoom control panel. But just know we will reserve answering questions until the end. If we don't get the chance to answer your specific question, don't worry, we will follow up with you by email as soon as we can. But of course, we do encourage you to reach out to either the PAN Foundation or Needy Meds if you need an answer right away. Of course, our contact information at the end of the presentation will also follow. So let's get started really quickly with what is Needy Meds for those of you not yet familiar with us. Needy Meds is a national nonprofit co-founded about 25 years ago by retired family physician Dr. Rich Sagel and his friend Libby Overly, who is actually a medical social worker. And what you're looking at on the screen is our mission statement, but simply put, we connect people to programs that will help them afford their healthcare expenses. And we do this completely free and anonymously through our website, needymeds.org, and our toll-free helpline, 1-800-503-6897. And of course, our contact information will be at the end of the presentation as well. So, as you saw, a big part of our mission a couple of slides ago is education. And we fulfill that part of our mission by, of course, educating people about Needy Meds and the resources we offer, but by also educating and informing our users about other resources that will help them empower themselves and help them save in other ways on their healthcare journey, which is why we are so pleased and honored to have a partnership with the PAN Foundation and representatives from their organization to share what they're all about. So first, if you're not familiar with the PAN Foundation, I really encourage you to check out their website. It is very easy to navigate, and you'll find a whole host of healthcare cost savings resources that I'm sure you will be interested in, your family, your loved ones, or your patients or clients. So simply put, the PAN Foundation helps underinsured people with life-threatening, chronic and rare diseases get the medications and treatment they need by paying for their out-of-pocket costs and advocating for improved access and affordability. Now, let me tell you a little bit about the guests that we have here with us today. Amanda Barnes, who is the operations manager for PAN, joined their call center in 2019 as a supervisor and has since been promoted to senior supervisor and operations manager. In her current role, Amanda oversees the call center teams that support enrolling patients for a grant. Prior to joining the PAN call center, Amanda managed call center operations for another foundation supporting patient assistance. Amanda is always looking for new ways to help improve the team in both quality and efficiency. And speaking from a nonprofit, Needy Meds, that also has a large call center, I can't tell you how critical that role really is. So we're so happy to have her here with us today. Now, Amanda's coworker, Jessica McLaughlin, is the clinical affairs specialist at the PAN Foundation. Jessica joined PAN in 2017 in the Patient Support Services Claims Department. And again, another crucial role at the PAN Foundation. She served as team leader with her expertise and background in claims processing and customer service in a healthcare setting. Jessica graduated from Duquesne Milan School of Pharmacy in 2014 She worked previously as a pharmacy manager for CVS. As a clinical affairs specialist, Jessica works diligently to research potential areas of patient need for those who suffer from rare, chronic, or cancer diseases that put a high out of pocket cost burden on patients. She is also responsible for ensuring all of the PAN's disease funds are well maintained and in accordance with the most up-to-date clinical practice guidelines. So we are so grateful for Amanda and Jessica being here today and taking time out of their very busy schedules to share how they could help Needy Meds users and beyond take advantage of all of the cost savings resources the PAN Foundation has to offer. So now, without further ado, I'm going to go ahead and pass the mic and the screen to Amanda. So let's see if you're able to grab that screen. Perfect. That looks fantastic. And without further ado, I'm going to go ahead and pass the mic to you, Amanda. To those that joined us, again, a reminder, if you do have questions, feel free to submit them in your Zoom control panel, either via the Q&A or the chat section. Thanks so much for being here. Amanda, it's all yours.
Thank you, Carla, for the warm introduction. Hello, everyone. We are so glad you could take time out of your busy schedule to join our webinar today on connecting underinsured patients with the treatment that they need at the Patient Access Network Foundation, also known as the PAN Foundation. As Carla mentioned, my name is Amanda Barnes. I am the Operations Manager of the Patient Support Services at PAN, and I'm joined today by my colleague, Jessica McLaughlin, PharmD of our Clinical Affairs Specialist. So today we will introduce you to who we are, why we do what we do, and how you can apply and receive assistance with the PAN Foundation, as well as additional resources to keep you connected. We know that we will share a lot of information and you may not be able to absorb it all, so we encourage you to send us your questions in the chat box during the webinar. Without further ado, we'll go ahead and get started. So the need for charitable assistance is we have a history of patients that we are assisting. We started in 2003, Congress created the Medicare Part D program to cover outpatient prescription drugs. It does require patients to pay out-of-pocket copayments, which can easily run thousands of dollars. Since pharmaceutical companies are prohibited from providing direct support to federally insured patients, independent charitable assistance foundations were established to help fill in these gaps with the safety net. And that's where we have PAN come in. So there is a rise of out-of-pocket costs for prescription drugs that impact economically vulnerable patients. 47% of US adults said that they is very somewhat difficult to afford their healthcare costs, while 50% of US adults said that they would be unable to pay a $500 unexpected medical bill without borrowing money. So about PAN. We are a national independent 501c3 organization dedicated to helping people with life-threatening, chronic, and rare diseases get the medications and treatments that they need by assisting with their out-of-pocket costs and advocating for improved access and affordability. Since 2004, we have assisted over 1 million uninsured patients. We have over 4 billion in financial assistance provided by us at PAN, and we have more than 70 disease-specific funds that we offer at any given time. We have a national reach. So our national reach, if you see here on the map, this is where we service all of our members. We also ensure that patients across all 50 states and the US territories can receive effective, efficient patient assistance when they need it. Our patient reach in 2022, we had unwavering support for the underinsured patients. We provided over 325 million copay assistance for patients enrolled. We had 169,000 grants issued to the underinsured patients. We had over 130,000 patients that we assisted, and over 23,000 patients referred to Alliance Partners. This is our network of disease-specific national patient groups. We have a very broad network. PAN works closely with a large number of healthcare and pharmacy professionals and diverse national and community-based organizations to connect patients with the financial assistance that they need to afford their out-of-pocket prescription costs. So here we have on the chart, we have health research organizations, academic institutions, disability organizations, caregiver groups, patient advocacy organizations, national provider and pharmacy organizations, community-based organizations, and public health agencies. PAN works closely with the network of healthcare and pharmacy professionals to connect their patients with the financial assistance that they need to afford their out-of-pocket prescription cost. Over 10,000 healthcare and pharmacy professionals are in our network, and 98% of them said that they are likely to recommend PAN to their colleagues, other providers, or pharmacists. Our national and community-based partnerships, we have a few of them listed here. We also have a strong partnership with them. They are our partners that allow us to educate key stakeholders, including providers and patients, about the assistance role for charitable assistance foundations. We also have alliance partners, so we have a couple of them listed here. We partner with 25 plus leading national patient advocacy groups around the country to support the patient holistically by providing disease-specific education, emotional support, and other services. In 2022, we referred nearly 23,000 patients to our alliance partners for additional support. Our impact. So our all-time impact, we have answered 4.5 million calls. We send out surveys to our patients and we have a 9.5 out of 10% score. We have $4 billion in life-changing assistance provided. We offer 23 languages when they call into the call center. 52% increase in medication adherence on average, and 100,000 patients connected with our alliance partners. So before patients received their grant, we had a survey where over 50% of our PANS patients reported skipping doses or not taking their medications as prescribed. Once they got a donation, once they received a grant from us after receiving their copay assistance, 17% of the patients reported skipping doses or not taking medications as prescribed. And patients also reported a 33% decrease in skipping those doses or not taking medications as prescribed. Our annual survey found that nearly all patients agree that PANS assistance is able to make me more likely to take my medication as prescribed, as 94%, has had a positive impact on my family at 94%, has improved my quality of life at 92%, and has decreased my stress levels for my whole family at 93%. This survey was also shared with our providers that agree with PAN's assistance of improving patients' quality of life by 97%, makes patients more likely to take medications as prescribed at 94%, decrease stress for the whole family, 95%, and improves their overall health at 93%. So about our funds. We provide 3 types of funding spanning a portfolio of more than 70 oncology, chronic, and rare diseases. So we assist with medication copays, deductibles, and coinsurance, health insurance premiums, and transportation costs associated with treatment. Here is a list of our disease areas we cover. You'll see here we have it broken down into our chronic, rare, and oncology. If there's an asterisk next to the fund, we also offer premium assistance. So just to name a few, there is hemophilia, Fabry disease, short bowel syndrome. So understanding our fund statuses. So there's 3 different statuses that a fund can be listed for. Open, which is open for the general public to apply. Closed, which is meaning that the fund is unavailable due to funding and the patient can be added to a wait list, and open to wait list. So when the fund is closed, they're added to the wait list, and once funding is available, the patient can then apply. How our grants work. So about our PAN grants, we assist amounts vary per disease fund. Our assistance amounts are designed to cover the average annual out-of-pocket treatment cost per year with the disease covered. Patients have a 12-month eligibility period, so new patients will receive a 3-month look-back period as well to help cover those medications that they may have paid out of pocket for before they received a grant with PAN. Patients or their provider or pharmacy must submit a claim every 120 days. We'll send a notification letter if they don't get a paid claim within the 90 days. If we don't hear back from you on the 120 day, we'll release the funds to help others in need. And you can also renew your grant. So there is a renewal application that we can accept 1 month before your eligibility period ends, which is subject to available funding. Medication assistance for our disease funds. So there are some things that we do cover and things that we don't. We do assist with prescription medications, including generic or bioequivalent drugs that are FDA approved or listed in official Compendia or published evidence based on clinical guidelines. We do not assist with medical services that offer visits or lab work, products not covered by insurance or paid at 100%, and products billed only to discount cards. We have different types of disease funds. We always list the subtypes that are available for each disease fund as well. So the subtypes can be found in the About the Disease section of the specific disease fund. For example, inflammatory bowel disease lists subtypes, includes chronic diseases, and ulcerative colitis. Patients or their provider or pharmacy can search the disease fund by subtype. And also about our diseases, inflammatory bowel disease, IBD or UC, also known as ileitis and colitis ulcerosa, is the chronic inflammation of all or type of the digestive tract. It is a chronic disease of the digestive system. Subtypes include Crohn's disease and ulcerative colitis. We also have transportation assistance. So many patients lack reliable transportation, leading to poor health outcomes and limited access to the care that they need and deserve. That's where PAN offers a transportation assistance program, allowing patients to easily access healthcare services, receive social support, and even travel to the grocery store or a food bank. Over 3,500 patients have been provided with the assistance for the transportation fund. The impact of our grants, we send out a survey to all of our patients that showed greatly improved quality of life. Patients were able to visit their doctors and pick up prescriptions more reliable and have expanded the grant to focus on patients' overall health. So now at this point, I'm going to turn it over to Jessica so she can tell you how you can apply for a grant. Jessica?
Thanks, Amanda. How do you apply for a grant with the PAN Foundation? You can apply in 4 easy steps. 1, check if the fund is open. 2, verify your eligibility criteria for the fund. 3, gather all the required information for the application. And 4, submit the application. You'll find out instantly if you've been approved and can be using your grant right away. As I mentioned, step 1 is to check to see if our fund is open. There are 3 ways to check the status of PAN funds. You can visit PAN's website at www.panfoundation.org, Or you can use our existing PAN portal, use your existing PAN portal account, which you can find at www.panfoundation.org/panportals. And lastly, you can give us a call at 1-866-316-7263 between the hours of 9 a.m. and 5:30 p.m. Eastern Standard Time, Monday through Friday. Your next step is going to verify if you meet the eligibility criteria. Patients must meet the following requirements to be eligible for financial assistance at PAN. Patients must be getting treatment for the disease named in the assistance program. They must be taking a medication that's covered by the patient's insurance and listed on our disease fund formulary. Have an income at or below 400 to 500% of the federal poverty level. Patients must live and receive treatment in the United States or a U.S. territory. And patients must have health insurance that covers your qualifying medication or product. Certain programs do have additional requirements, and you can check the PAN website for more details. Patients and their caregivers, providers, and/or pharmacists can check our patients' eligibility for a disease fund and begin the application process right from the panfoundation.org homepage. Your third step is to gather all the required information that you'll need for the application. 3 ways to check the status of PAN funds. Uh, you want to make sure that you have all of your patients' demographics, uh, meaning their first and last name, date of birth, and those types of things. Diagnosis and medication name, insurance information, your patient's income information, as well as the treating provider's information. Now you are ready to go and submit an application. You can start an application on our website at www.panfoundation.org, or you can always use your existing portal account at www.panfoundation.org/pan portals. If you are not comfortable submitting your application on the online, you can give us a call and apply over the phone at 1-866-316-7263 between the hours of 9 a.m. and 5:30 p.m. Eastern Standard Time, Monday through Friday. We also have a translation service available over the phone for non-English speakers. What happens once you've submitted the application? PAN will review the application and a decision will be provided instantly. Once the application has been reviewed and processed and approved, you've been enrolled, and you can begin submitting reimbursement requests to PAN. Patients' benefits of our efficient enrollment process: 100% of our applicants receive real-time income verification through Experian PayNav. It takes 10 seconds for a post-application submission needed on average to provide an instant enrollment. 100% of our grant funding is available to the patient upon approval. We received a 9.8 satisfaction rating from the people that we serve. PAN's optimized patient enrollment process and patient experience score highlights our ability to serve patients in the best way possible. We were the first foundation to offer real-time income verification. How we help patients when a fund is closed. The waitlist. PAN offers a disease fund waitlist for each of our funds. The waitlist is a list of patients waiting to apply for a closed copay fund, health insurance premium fund, or our transportation fund. Patients may add themselves to the waitlist or be added by their provider, pharmacy, or caregiver. When you go on our website, if you find a disease fund on the website and you check the eligibility, you provide the patient information to sign up for the waitlist, and you'll get an email confirming after you've submitted the patient to our waitlist. Once a patient is added to the waitlist, you will get an email when the waitlist opens, advising you to either apply online or by phone. In that email, you will be advised you have 48 hours to apply before the fund is open to the public. If you don't get a grant after our 48-hour window closes and applications have been processed, you will be placed back on the wait list until it reopens. When a waitlist opens, patients on the waitlist get the first chance to apply for a fund when it opens. You will get an email with a link to apply and your unique waitlist ID. You have 2 business days or 48 hours to apply, or you will be removed from the waitlist. Grants are provided in the order people joined the waitlist, first come, first serve, not the order in which they submitted their application. PAN offers a real-time referral system to other patient organizations if a disease fund is closed. You can find these, if available, on the specific disease fund page. Fund Finder in 2018 was developed as the first free web-based app to instantly alert patients and healthcare professionals about available assistance programs and corresponding support organizations for fast and easy patient support. In 2021, the Fund Finder won the Edison Award for Best New Product and Innovation Services within prescription drug access platforms, as well as won the e-Healthcare Leadership Award. Currently, Fund Finder has 70,000 plus users and growing. Over 50% of the users of Fund Finder are patients. We have over 200 plus assistance programs in one place, easily accessible, as well as over 130 advocacy and patient support organizations listed as well. PAN's approach to advocacy and education. Our advocacy mission, we advocate for improved healthcare access, affordability, and equity for all so that people can live with the lives they deserve. PAN is now offering a new hub that centers around Medicare reforms education. This new hub acts as an easy to understand guide about upcoming Medicare reform passed as part of the Inflation Reduction Act. It also goes over the costs and impacts of these reforms for people who are on Medicare, and it helps our users navigate new changes at their own pace. You can visit this new hub at www.panfoundation.org/reforms to learn more. How to get involved and stay connected with the PAN Foundation. You can always connect with us on social media. We have a Facebook page, Instagram, YouTube. You can even find us on LinkedIn and on X. And all of our usernames are listed here for your convenience. You can also stay connected with PAN updates by signing up for emails to learn more about new programs, advocate for healthcare access, and get involved with the PAN community. Feel free to use this QR code on your screen to learn more and subscribe today. If you ever have any questions or concerns regarding any information you've seen here or want further information or contact or work with PAN Foundation, you can contact us here on our website at panfoundation.org under our Contact Us form, as well as you can utilize our fundfinder.org or give us a call at the number on your screen any time Monday through Friday between 9 a.m. and 5:30 p.m. Eastern Standard Time. And I will hand this back over to Carla and appreciate your time.
Wonderful. Thank you so much to both Amanda and Jessica, friends and colleagues and representatives from the PAN Foundation, for that very thorough and certainly easy to understand presentation. I'm going to attempt to share my PowerPoint slide deck in slideshow mode. And Amanda, Jessica, does that look like it's in slideshow mode still?
Not at the moment.
Let's give this a try.
There we go.
Look at that. That wasn't too clunky. So thanks for your patience, everybody. And thank you again to Amanda and Jessica for that great presentation. Amanda, you pointed out some of the astounding stats in addition to a whole bunch of other really important information with the PAN Foundation, but what really sticks with me because Needy Meds has been had such a long history of partnership for the PAN Foundation. We've watched you all proudly grow. I really am just blown away by the broad network of supporters, collaborators, and partners the PAN Foundation has built. And the number that just blew me away is $4 billion worth of financial assistance helping patients. That just blows me away. 4.5 million calls of representing patients, caregivers, family members, and those struggling with specific diseases and diagnosis. So that's just incredible. And it gives Needy Meds users just a glimpse at the breadth and scope of not only the resources the PAN Foundation provides, but the breadth and scope of the population you serve. And Jessica did a perfect job of showcasing, really importantly, how easy it is to enroll. And I love that your presentation included, Jessica, pretty much all of the FAQs that I know you guys get a lot, such as how do I start an application? Where do I get help? And really importantly, what do I do if my fund is closed? I am always blown away by the fact that the PAN Foundation will give those that enrolled an instant decision, and can't stress enough to our users to check out and use Fund Finder. And again, that's fundfinder.org. I am not surprised that it's an award-winning app. So I do see a lot of questions coming in already. For those of you that need a reminder, you can submit those into the Q&A or chat section of your Zoom control panel. We do keep the question segments relatively brief, so don't worry if we don't get a chance to answer your question. We will have our contact information up at the end. Just a reminder that Needy Meds is also here as a source of support if you, your loved ones, patients or clients are having difficulty affording their medications or other healthcare costs. What you're looking at on the screen are all of the categories that you can find under the Healthcare Savings tab of needymeds.org that will help you to connect with cost savings programs or resources, again, for medications and other healthcare costs. So please check that out or reach out to one of our call center counselors if you'd like to learn more. And of course, we encourage you to check out our upcoming calendar of events. We're proud to say that we do have other PAN webinars that you should be on the lookout for, but we also have webinars about Needy Meds, so check that out again if you'd like to learn more. We're going to get to those questions coming in, and as I do, I want to leave up, as promised, the contact information for the PAN Foundation. Their website is panfoundation.org. Their call center is 866-316-7263. And again, not on the screen, but check out fundfinder.org. And of course, the Needy Meds contact information is at the bottom of that screen. So let's start by getting to the questions that came in. So this one, I think makes the most sense for me to direct to Amanda, but certainly Amanda and Jessica jump in as you feel appropriate. But this question that came in is, when applying for assistance, do I need to provide any paper documents to verify my income? Which is a great question and probably one you guys get a lot.
Yes, it is one that we do get a lot. So you do not typically need to provide any paper documents when you're applying. Our application can be completed online or over the phone in less than 10 minutes. If you had a recent change in your income, we may follow up with you later to verify your income. And then in that case, we'll notify you exactly what you need to submit and the deadline of when it's due.
Perfect. I'm so glad when our audience participates, because I always feel like if there is an audience member that has a question, it's probable that other audience members have that as well. And it gives our presenters a great opportunity to stress usually really important points. So thanks for the question and the informative answer, Amanda. So Jessica, this one I think makes most sense to ask you. And again, probably another question you get all the time, which is, what if I don't know the diagnosis code when I call?
Thanks, Carla. This is one of are frequently asked questions by patients and their providers when they call in. As long as you know the name of the disease state and the medication you are taking to treat it, our patient support specialist can search our system to determine if your condition and medication qualifies for any of our assistance programs. You can also check if your disease is covered by searching for your disease name or the disease subtype on the Find a Disease Fund page on the PAN's website. Another search criteria you can also use on our website is your medication. This will generate all the programs that cover your medications to determine if it matches your disease state. And finally, your healthcare provider can check your diagnosis codes on our website via the search bar or on the individual assistance page and apply on your behalf. If you still aren't sure, we recommend that you follow up with your healthcare provider to determine the correct disease fund you should enroll at PAN.
Fantastic. And this question, it really gave an opportunity to showcase how the PAN Foundation has really gone above and beyond to make sure the enrollment process is not only fast, but super easy, logical. And if you do have any questions along the way, you can always reach out to them and they will help you. So, Amanda, I'm going to direct this next one back to you, which is what can I do if my medication is not covered?
That's a great question. So on our website under Find a Disease Fund, you may send us a message if you do not see your medication listed. In addition, you can also call us at 866-316-7263 and submit your request. You do have to allow us 7 business days for PAN to review and follow up on your request.
That's great. And Amanda, thank you for the phone number for those of you that are just listening in. And I always appreciate when organizations let us know and let their patients know expectation. It's important to realize that for PAN to be able to thoroughly and correctly answer such inquiries, it may take up to 7 business days. So it's important to know that right out of the gate. So Jessica, I'm going to go ahead and go right back to you for another question, which is my rare disease is not on the list of disease funds. How can I request this fund? Another really good question.
Yeah, another really great question. So if you do not see your rare disease on our list of disease funds, you can submit a message with the disease state to us via our contact us form on the PAN website. In addition, you can also call us and submit your request. We are consistently reviewing disease states to find additional ways that we can assist patients with high out-of-pocket costs.
That's fantastic. And as I said, Needy Meds has been a proud partner of the PAN Foundation for a long time. And I can attest to that they really do go above and beyond to find additional ways to help patients with those really high out of pocket costs. So as I said, we do try to keep the question segment relatively brief. So I'm going to go ahead and wrap up with just one last question. And I think, Amanda, this would be one I'll ask you to handle, but certainly Jessica, chime in if you feel you'd like to add anything. And the final question that we're going to wrap up today's presentation with is, would I be able to apply for additional funding if I know I will need more money for the rest of the year? Another great question.
Yeah, that is a great question. So I think it is important to note that you are only eligible to apply for additional funding when your grant balance is 0. So once your grant balance is 0, you may apply for additional funding at any time during the eligibility period if the disease fund is open. So that's a key part to remember. The disease fund has to be open in order for you to get that additional funding.
Fantastic. Thank you so much again to my friends and colleagues, Amanda and Jessica, for taking time out of their super busy schedules to showcase the PAN Foundation and the resources they offer, the healthcare cost savings resources they offer to those that really need it. And that population of those that really need it is certainly growing. Again, a reminder to everybody that you will see the PAN Foundation webinars pop up on our calendar of events. So be sure to check back. And I'll remind you that all of our webinars, presentations, and videos are uploaded to the Needy Meds YouTube channel. And I feel like that's super important to stress for a number of reasons. First of all, for those of you joining us today, as you saw, Jessica and Amanda covered a ton of information. So having the webinar as a video so that you can refer back to it is super helpful. We also do this because we all know, I've been there, I sign up for webinars, have every intention of attending, and life gets in the way. So we do upload all of these webinars again onto that Needy Meds YouTube channel for those of you that unfortunately missed out. That way you can be sure not to have to pass on any topics you really would benefit from learning about. Also, it's a great opportunity to share a webinar with those you think would also be interested in or benefit from the topic. And again, that includes friends, loved ones, family members, and even patients and clients. So we do look forward to seeing your names pop up in future webinars. I encourage everybody to visit that panfoundation.org site, the fundfinder.org site. And of course, follow the Pan Foundation on social media, a great way to stay in touch. With that, big thanks to our presenters and those that joined us for taking time out of their day to learn a little bit more about our partner, the Pan Foundation. Thanks, everybody, and have a great rest of the day. Take care.